So, Bob, I have some questions from some patrons and some psychology news stories, and I thought I would, pose these questions to the two of us, and two therapists would answer the questions. What do you say?
Yeah, let's do that.
This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor.
I am your old friend from graduate school. My name is Bob Goettle. I am a therapist in practice here in Seattle.
The first email here is from patron Hillary. She writes, how would you treat childhood trauma if someone who has all the signs of PTSD... how would you treat childhood trauma in someone who has all the signs of PTSD but few explicit memories? For example, they may remember a few instances that clearly point to patterns of terrible things taking place in the past, but they can only remember a small number of specific events. Do you just process those few events that are remembered and hope for the best? What do you think, Bob?
You should do that, probably, if those events are traumatic. And the good thing about good treatment for PTSD is you do not have to generate or have memory. All you have to do is look for what are the cues that set off the symptoms of anxiety. And those could be things that a person comes across, like a smell or a sight or an anniversary date or whatever. And if you do exposure to the things that actually cause the anxiety, you can treat the PTSD successfully, and the person doesn't need to have memory.
Right. So the idea is that as they're triggered by a smell or a like a movie actor or something, you expose them to that, after them becoming aware of their emotions and knowing how to reduce their distress.
Right.
And then through those triggers, while experiencing those triggers, they have an elevation in arousal and stress, and you work together, or even the client just does it on their own, do relaxation, distress tolerance, and it brings it down, and eventually you become habituated to that trigger.
Yeah.
And then in the end, you just keep doing that, and eventually you don't have PTSD anymore.
Right.
So you don't have to remember the actual events. For some people, they do remember a lot of the events vividly, and you can do triggers, but you can also just remember the actual events, and then through that you become habituated to those memories.
Right.
Because the memories are the triggers.
Right.
And then you can treat the PTSD that way. Yeah. There's sort of a myth from the old Freudian days that you, quote unquote, have to work through or process events and memories that have happened to you. You have to unearth them.
Yeah.
And that is kind of true in a sense, in that when we go through difficult times, it sometimes is good to talk about them and quote unquote process them. If it's PTSD related, then it's good to become habituated to those memories. Right. But the notion that every difficult memory has to be unearthed and quote unquote processed by talking about it is a myth.
Yeah. Well, PTSD is a thing that happens in the present moment. It doesn't happen in the past.
Right.
So what are the things that are bugging me today? What are the things that are scaring the hell out of me today?
Right.
Those are the things I want to treat, because that's where the trauma is.
Right. In a sense, it's like treating a phobia or something.
Treating a phobia.
Yeah.
Yeah. Usually it's exactly treating a phobia. Yeah.
Yeah. PTSD in DSM-4 used to be in the anxiety chapter. Was it not?
Yeah.
And now it's in a trauma related chapter, I think.
Is that right?
I think so.
Yeah.
Which I find to be, I guess, makes sense in a certain way. I'm sure there was some justification for that, but at the same time, I'm like, I think it should still be considered anxiety.
It is primarily.
Yeah. It's fear,
panic.
Yeah.
Yeah.
Right. So yeah.
Hillary, you want to treat this phenomenologically. What's in front of you and work with that. You don't have to worry about what the person doesn't remember. The stuff they don't remember is not bothering them.
Absolutely. And there are even times when I have worked with clients where we have quote unquote processed past memories without them remember anything. I had a client once who didn't remember a single thing from before she was like 10 or 9 years old.
Oh, wow, yeah.
But we knew enough of what was likely happening that we quote unquote process and work through those things. We didn't really treat PTSD around that because there wasn't any direct distress from memories because there were no memories. But the meaning making or the narrative work can be done by supposing or imagining based on what she did remember past 10 and sort of extrapolated back, you know. And when we would do that, she would have emotions, you know. She would think, wow, when I was 5, I must have been going through this or that. And that was very sad for her, but she didn't remember she didn't remember a single thing about it. She's like, yeah, that's probably what happened. And that felt like letting out those emotions and whatnot. Hillary also asks, can you talk about specific signs to a therapist that their client is dissociating? And on the flip side, how can a client become aware that they're dissociating? I would love to hear maybe Bob and you answer these questions. What do you think?
I think we could answer these questions. It's a good question. How do you know if somebody's dissociating? I'm thinking about somebody that I work with now, and one of the things that she does is she looks down. She gets quiet. She kind of has a inward kind of body posture. I don't like saying it that way, but she's definitely withdrawn, I guess is the best way to put it. And oddly enough, this is about 3 weeks ago. I've been working on attunement in my sessions and just being slow and quiet and paying very good attention. And interestingly enough, when she dissociated, so did I.
Wow.
And I said to her, are you dissociating? And she's like, yeah. And my clue was just my own inner experience of unreality. And, you know, attunement is awesome.
Yeah. Do you dissociate sometimes?
Yeah.
Oh, I didn't know
does.
that.
Yeah.
What? What'd you say?
Everybody does. I mean, it's daydreaming is dissociating. But you're asking if I dissociate like...
Trauma-related.
Trauma-related dissociation? Yeah.
Oh.
Yeah.
Interesting. Yeah. So that's one observation.
Yeah.
But it's kind of hard to describe, right? Because a lot of people look down.
Sure.
A lot of people become inward.
Right.
To me, because people ask me this sometimes, and sometimes I feel compelled to explain it, particularly to trainees, because I feel like dissociation is frequent in therapy offices, and a lot of therapists, particularly novice therapists, have no idea how to detect it. You know, it's one thing when someone comes in and they're like, I'm really scared, or I'm suffering from anxiety, or I'm depressed or something. When people who are dissociating, particularly people who haven't been in therapy a lot with an expert, they don't know they're dissociating.
Yeah.
It's something that when you actually discover it together, they're like, I think I've been dissociating every other day for my entire life.
Right.
And I always sort of thought of it as just, isn't everyone else like that?
That's my normal.
Or I think I always just kind of ignored it or something,
right.
you know. But now that I think about it, I think I've been zoning out frequently.
Yeah.
You know, it's very upsetting to people to think that they have this mechanism that kicks in that, you know, causes them to separate somewhat from reality.
Right.
So you're asking what are the specific signs that a therapist could look for. To me, when I was thinking about this, you really just have to experience it. It's a felt sense. I'll just tell you my own path. So when I first learned about dissociation in graduate school, it was explained to me. There's probably a vignette or something, but I had no idea what to look for, you know. Most of it, and then over time, I would work with people and I would, you know, find out that they had been traumatized or they have a lot of stress in their life or something. And then I would start to notice there were some times in sessions where they were less responsive than other times.
Yeah.
And then they might come in the next session and say like, yeah, I think I was sort of out of it last time. And then I'd be like, oh, is that dissociation? And then I would ask them, you know, more questions about that experience. And then, you know, working with, you know, a handful of clients like this, eventually I started having a good conceptualization with them and a general conceptualization of what dissociation is and sort of the discovery of it. Because a client comes into your office and you just ask them, do you ever dissociate? most, like I said, people are going to say, no, I don't. Or what is that? But anyway, so working with those people for many years, and then subsequent people after that, I now have, and Bob, you do too, a sense of the kinds of things that you're going to see and the kinds of things you're going to feel. Like as a therapist, countertransference wise, like you said, you started to dissociate because they started to dissociate.
Yeah,
and the that feeling that you get, like you might be a little spacey, or you might feel like you're kind of chasing them, or you might feel like the room has gotten darker or deader or something.
right.
And that's something that you can't explain to people.
You have to kind of find that out as you go through it.
Yeah.
This is what it's like, and a person develops.
Right. And the analogy that I thought of was, it'd be like, asking a heart surgeon, explain heart surgery to me.
Right.
What is heart surgery like?
Sure.
Or how do I do heart surgery?
Right.
How do I detect, the need for heart surgery? It's like, you would never expect, a heart surgeon to explain it to you
Right.
in a short form and have you know the answer to that question. You have to be next to that person as they're doing it, or experience it yourself, and then
Yeah.
And so with dissociation, I think it's that. There are other conditions like depression, for example, that I think are easier. But even then, I think all of them really, you have to, with all the conditions, even the more simple ones like panic or something, I think you have to be with someone and really have them describe it to you and be with them week in, week out. It's not something that you can just quickly describe to somebody.
Yeah.
And
And even you, as far as you and me know, for all we know, we miss times when that happens. What do they say? They say good moms are attuned to their kids like a third of the time.
Yeah.
Or something like that. And, that's good moms. And kids grow up and they're good kids, or they have good enough mental health, and, parents got it right a third of the time or something like that.
Right.
Yeah. Though, I think it's also reasonable to ask your client, if you think that there's something going on, to ask, are you feeling checked out? Are you feeling unreal? The question I've been asking a lot of people lately is, where do your eyes want to go? And what's funny? I don't know if you've noticed this. I've noticed this in my own personal counseling, and I've been watching my clients. They all have favorite spots in the room for their eyes to go.
Oh yeah.
Yeah. So I've got a couple of my favorites, and
Where do you look?
when I'm in counseling, I look out the window and at the Space Needle is one of my places. And sometimes I look at the bricks across the alley from where my counselor's office is.
Where is your counselor's office?
Down Queen Anne.
Oh, okay.
Yeah. Or sometimes I just monkey with the vision of the blinds in his office.
So for those
books.
who aren't familiar with Seattle, essentially Bob's therapist lives just a little bit down the hill from where Fraser was supposed to be living.
That's right.
And so Bob can look out the window and has the Fraser view of Space Needle. It's funny, like there are people will email or comment or something, and they'll be like, "Oh, there's a therapist in Seattle. That's like Fraser." It's like they know two things about Seattle,
Right?
Fraser and rain,
Right.
And it's just. Or Sleepless in Seattle is, I guess.
Right, that's the one, yeah.
Yeah, and it's just funny to,
people still go to that guy's houseboat.
Really?
Yeah.
Is it still there?
Yeah, it's still there.
Wow.
Yeah, it's like $2 million. I think it was for sale recently.
Yeah.
Yeah.
Yeah, houseboats. I had a friend who had a houseboat down there in the 90s. Did you ever go with me? He would have a lot of parties at that houseboat.
Who's that?
Lusby, Pete Lusby.
No, I don't think I ever went.
It was cool. It just seems cool. So if you're not familiar with Seattle, there's this Lake Union, which is right in the middle of Seattle. It's this huge lake that's just like plopped right in the middle of Seattle, and it has inlets. It's in between the Puget Sound and a huger lake, Lake Washington, and they're maybe on both sides, East Lake and West Lake.
And North Lake.
And North Lake too.
Yeah.
There are a bunch of these long docks, and then there's these houseboats, and they look like little houses that are floating there. And they are often compact is one of the things. And they often have roof decks,
Yeah.
And they seem super cool, right? It's just like, oh, how cool would it be to like,
Yeah.
live in a house that's floating on the water? It
Right.
just seems so cool. But
Look at the city, the skyline, yada yada.
right, but it has all sorts of problems when there's waves, which aren't very frequent. Your house starts to move.
It moves. It's definitely floating.
And all the infrastructure has to be adapted to floating.
Yeah.
So your cable internet, your power, your plumbing,
Yeah.
your waste disposal, taking the garbage out. A boat doesn't come by and get your garbage. You have to haul your garbage all the way up to down the dock and da da da.
Yeah.
There's probably some noise issues or something. So he would talk about how it was kind of a pain.
Yeah.
The houseboat was a little bit overblown. Anyway, how did we get on that topic? So just some descriptions that you can work with your clients, and that's what you do. It's It would be really hard to detect dissociation without having the client tell you what's happening with them.
Yeah.
It'd be hard to just look at someone and say, oh, they're dissociating.
Right.
So it's a matter of asking them. So if,
Yeah.
you brought up some descriptions that they might say. They might feel unreal, which is an interesting word, right? It's like, well, what does that mean? Can you describe that a little bit?
Yeah, things around me don't feel real. Sometimes I'm not sure I'm real, but there's a sort of like a film or a blanket between me and other people, and I feel out of touch. I feel fuzzy-brained. I often don't know what my own emotional state is, and I can't think very clearly. I can't form words very, very easily. And it's, sometimes it's, not as intense as other times. Some people, they absolutely lose track of time. They are in an altered state and they don't notice the passage of time. And then, minutes, hours later, they don't remember anything that happened in between. There's this lost gap. I don't have that severe experience. I don't think I've ever had that.
Yeah, good. Yeah, excellent description. Sometimes people say they feel spacey or not really there.
Yeah.
They'll say, or like you said, you don't even know what emotions you're having.
Yeah.
I mean, that's the whole purpose of dissociation is to help you cope with unbearable emotions and situations.
Natural process. The brain develops it, if I remember right, around age 5, and everybody has the capacity and needs it.
Interesting. Yeah. I've never really looked into the research, but from my experience, and it stands to reason that all of us are born with the capacity to dissociate, but only some of us need it growing up.
Yeah, right. To survive. Awful.
Right. And for those who need it because they're dealing with very difficult things, whether it's bad parenting or even just war or something.
Right.
And if you use that mechanism enough prior to age 5, then for the rest of your life, you retain that reaction in all likelihood.
Yeah.
So for me, I didn't need that coping skill. Or that I didn't rely on that when I was young, or at least I don't remember doing it.
Sure. And as an adult, you don't find that.
Right.
Yeah.
As an adult, I could be absolutely freaking out about something and probably need to dissociate, and I can't because it was never developed. Those neuronal pathways weren't strengthened as a child. An analogy is like, we're all born with the ability to vocalize in all languages.
Oh, okay, right.
Like a 3-month-old will goo goo gaga in such a way that you will hear syllables that only, Mandarin speakers can say, but English people cannot say.
They can't form them.
But through reinforcement and mimicry, children will pare away certain syllables that aren't used in the context that they're in, and then by the time they're 5 and older, they can't make. There's certain syllables in Chinese that you and I could never do. Like we can't even hear the
can't hear them.
differences. Like,
Yeah.
have you had that test where there's these two vowel sounds that Chinese people can absolutely tell the difference between?
No.
It just keeps repeating. It's just like eh, 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 and to them it's like oh, e,
Yeah.
oh, e, but to us it's eh, 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 and and that's not because we're not paying attention. It's because our brain has lost the ability to differentiate between those two things, where they retained that ability, or
that's
they
fascinating.
built that when their brain was more plastic. You know
Right.
what I mean? And
vice versa.
right.
Yeah.
So, like, you'll hear people, Japanese people and, other people, they have a hard time between R and D or L.
R and L.
R and L.
Yeah.
And so, they won't, so they'll say things like actually Kirk, my name is, I have learned, it's to some people impossible to even understand.
Yeah.
Like even to Latin American people, which we wouldn't consider to be that different from English, you know. But when I was in Colombia or Cuba, they'd ask me my name and I'd say Kirk, and they just stare at me like, what are you saying? Like it was so hard for them to even hear, And then of course even if they did get it, they cannot pronounce it. Like there's this something about, I think I've learned that the vowel is quite unique to English and even American English. Like it's a very particular vowel that 99% of people don't understand and can't say.
Can you repeat how somebody might have said your name?
Oh, there's so many different adaptations. One is cock. So in Japan, I'm cock.
Oh, that's too bad.
Which is great. It's actually officially kaku because they frequently can't end a word on a consonant.
Yeah.
So but short, it's cock, which is great. Kidik is another one. So kidik, there's no in there, right?
This is a rolled R.
Kidik.
Yeah.
Kidik. Or kidik, like just because the Kirk is like really hard for people. Anyway, how do we get on that topic?
Neuroplasticity.
Right. So if you develop that skill or use that skill as a young one, you retain that ability later in life.
I'm pretty sure my name is universally able to be pronounced.
Yeah.
It's terrible.
Well, I wonder though, because even I wonder if some people are more like Bob.
Oh, yeah. Germans. Bob.
Yeah. Yeah. Bob.
Yeah.
Get any boobs?
Not on purpose or not by accident.
Was that a nickname when you were a kid?
No.
Bob the Boob?
No.
I think that's a good
That's
nickname.
funny. I was always Bob, though. I was never Rob. I was never Robert and Bobby to my family.
Or you're Bobby to your family.
But most people, our generation, are Rob.
Right.
But I was never.
Or Robert.
Or Robert, occasionally.
Yeah, I find it in our generation, no one went by Michael or Robert or Jennifer.
Right.
Or Elizabeth.
Right.
Or Susan.
Right.
Or Alan. Like Jonathan.
Right.
Nobody. Most people had those long names, but nobody went by those full names.
Right.
Nobody. But today, almost everyone goes by those long names.
Oh, really?
Yeah. Like if your name's Jonathan, you do not let people call you John.
Really?
Yeah. Yeah. Younger people, I find that to be true.
I like a one-syllable name. It's just easier.
I do too. And I like the fact you go by Bob, you know. I like Michael Drain, for example, from Unpopular Culture Podcast. His name's Michael, and a lot of people call him Michael, but I like to call him Mike.
I thought he does. Does he go by Mike?
I think to his childhood friends, or maybe his family, I'm not sure.
Yeah.
But yeah, I don't know. Like I like Jen.
Yeah, Jen's good.
Maybe Jenny. I don't know.
Al's your buddy. Nick.
Al. My dad is Al.
Right.
He goes by Al. My mom, Susan, goes Sue.
Sue, right.
I mean, people should be able to be called what they want to be called.
Of course.
But if I had a preference, Kirk, it's a short name.
Yeah.
I just
Right there.
Yeah.
Kirky Joe occasionally.
I guess it's like conservation of energy or something.
Yeah, right, exactly.
All right, let's take a break. We get back. Let's answer more questions. What do you say, Bob?
Sure.
All right, we're back from the break. If you haven't become a patron, do so now. Go to patreon.com. Also, if you're having trouble accessing older episodes, email us at contact@psychologyandsaddle.com. We can usually help you. The best place to get older episodes, or really if you're searching for an episode, the best place to go is our website. Your phone app or Patreon or YouTube are not easily searchable, and many episodes aren't even on. Like right now, if you're listening on your phone, you probably only have access to the last 300 episodes. And we have over 800 episodes as of now. So if you're looking for archive, go to our website. If you were there in the past and were annoyed with it, I get it, but I recently revamped it so that it might be easier to peruse. There's categories of episodes, like
index it.
Yeah. So like I have a page for episodes for new therapists. I have a page for episodes for clients, like that address client issues.
Yeah.
I have a page on sexuality, a page on psychopathology, a page on personality disorders, a page on family things, a page on movies. You know what I mean?
Yeah.
So do that and also become a patron, because that's what cool people do. This next one is from an anonymous patron. They wrote, is it best to inform a client that you believe they have a narcissistic personality disorder diagnosis? My supervisor seems to think so, but after all the research I have read, I am not sure. Many people seem to say that if you tell a client with narcissistic personality disorder that they are narcissistic, it will alienate them from you. Bob, what do you think?
I don't think anybody should be shy about a diagnosis, but what is the point? Who cares? Right.
Exactly. So that's, to me, the question. It's like, well, what would be the purpose? I mean, on some level, I consider it an ethical issue that if you have diagnosed someone, particularly if you've sent that diagnosis to third-party payers, insurance companies,
sure,
then the client should be aware of that,
yeah,
in my opinion.
Absolutely.
But if that's not the case, and often you're not going to send a narcissistic personality disorder diagnosis to the insurance company, because I don't even know if they would reimburse for that.
Oh yeah, no, they'll reimburse for it if it's
medically necessary.
Yeah. I mean, it's like in the cookbook of disorders. So
okay,
yeah.
But some DSM labels are not.
Do they still have V codes?
Yeah, well, of course V codes, but for Medicaid for a while they weren't accepting adjustment disorders.
Oh no, I didn't know that.
Yeah.
Oh, wow.
If I remember right.
Yeah.
And I think even now they only accept adjustment disorders for a certain amount of time.
Yeah. Well, it's supposed to be time limited.
Right.
Yeah.
So, but I haven't run into that problem.
Right.
Have you? You don't.
I don't bill health insurance anymore.
Yeah. I use one. I use Blue Cross. That's the only one I use,
right,
because they reimburse pretty well and they're pretty low key.
I imagine whatever diagnosis you've ever put, they just process it.
Yeah. I've had a client who I've been billing under adjustment disorder for years without any pushback or anything,
So this person, I think the thing isn't should I or shouldn't I talk about the client's diagnosis, is what is my goal? What is it that I'm hoping to achieve? Because, I don't know that the diagnosis is all that important, but understanding, I keep using the word phenomenologically. Ugh, what an awful word. Anyways, but understanding a person where they are is important.
Yeah.
And that doesn't have much to do with, a label.
I like the word phenomenologically. My dissertation was a phenomenological study, and I typed the word phenomenological or, phenomenology so many times. It's a long, weird word.
It is.
There's a lot of sort of confusing little consonants and vowels in there.
Oh yeah.
But man, did I have a rhythm to to typing
You can
that
do it,
word.
right?
Yeah.
Yeah.
I sort of broke it up into three, there's the fem and then the minnow and then the ology, Anyway, the point is I like the word, continue to use it.
Right.
So so you're saying, Anonymous, you're like, is it best to inform a client that you believe they have a narcissistic personality disorder diagnosis? And you're saying your supervisor seems to think so. And what I would encourage you to do is to talk with your supervisor about that justification. My cat is, she awakens. I think when I'm talking, she thinks I'm talking to her.
Oh, of course you are.
And so she awakens and starts talking.
I had a cat that did that every time I got on the phone.
Right?
Yeah, I'd talk.
It's like, oh, you must be talking to me,
Yeah.
Yeah. Some people have cats that don't meow ever.
Uh-huh.
Like they never meow.
Just-
My cat meows hundreds of times a day.
Big talker.
Yeah.
Lots to say.
Yeah. And I know what her meows mean.
Oh, yeah.
Like right now she's like, hey, what's up?
Yeah.
I'm here. What are you guys doing? It's not that anthropomorphic, but it's like, it's an announcement that like, I'm in the room, notice me.
Yeah.
And I like you guys. Like that's I like you meow.
She never comes up to me.
Really?
Yeah.
Well, she's doing it now.
She is. She also cannot pronounce your name.
It's true. But she dissociates all the time now. So I would ask your supervisor, I would say like, well, why do you think it's important that I tell my clients that they have a personality disorder diagnosis?
And also, how does this advance our work?
Right. So that's the whole thing. It's like you said, what's the purpose? Now, with some people with personality disorders are, if someone had major depression, there wouldn't really be a question about whether or not you would tell them because it's not a big deal.
You'd be talking about depression as part of their,
right. You're just like, well, you qualify for the label of major depressive disorder.
Yeah.
So,
which can be actually validating.
Right. Some people love it. They're just like, oh, there's a thing.
There's a thing.
Right. That's how I cured the beginning of me curing myself of panic.
Right. That's
which
right.
was to find out that, oh, it's a thing.
It's a thing.
I'm not going crazy. It's not some amorphous, unique experience to me. It was the same actually when I always knew that death anxiety was a thing. I always knew that like some people kind of think about mortality more than others,
right.
and alternate between kind of worrying about it and otherwise. And I'd always sort of knew that intellectually, but when I read a phenomenological, so in my dissertation research, I was learning phenomenological research and how to write a report. So, because phenomenological reports are kind of unique because it's a lot of qualitative data.
Right.
It's all qualitative data. And how do you distill that down to a report dissertation, level? And so I was reading various different phenomenological studies, and one of them was on people's experience with death anxiety. And so there are all these quotes and categorized, and after reading that report, it was profound to me in terms of my feeling normal and feeling much more at peace, really. It's like, oh, this is a thing that a lot of people have. And I've read these other people describe my exact experience, and then it was like, it dissipated like 95% of the intensity.
Right.
Having said that, for people out there, it's never been intense. It's just like, to me, my death anxiety, quote unquote, has been more like this awareness, when people walk out into the world, like sometimes you're like, oh, I'm really aware of the weather right now, or I'm really aware of the smells of the ocean, or I'm really aware of, I don't know, like how people are walking, or, there's certain things you can pay attention to and certain things you will not pay attention to. Well, in the sphere of 1,000 things I pay attention to in the day, one of them is frequently the fact that this is one day closer to me dying.
Oh yeah.
And of everyone else that I know.
Right.
And, sometimes, probably once a month, I'll be in a crowd of people and I'll be like in 110 years, like, well, we're all dead.
Yeah.
We're all rotting in the ground or, dust in the wind.
Right.
And it just interests me. I don't panic in that moment, but it's just sort of like, isn't that interesting? And it puts things in perspective, really, that awareness of like, it's sort of like when, I don't know if this analogy is going to make any sense, but in my head, pre-formed into words, it makes sense already to me, is everyone has a sense of what time of day it is, right? So in the morning, you have a whole day ahead of you, right? If you are a sort of person who sleeps at night. So you have a lot of things that you can do. You have a lot of things that you can get done. And there's not sort of a panic of like, oh shit, like I only have a certain amount of time left. Midday, there's a different sense of like, okay, what have I gotten done? Where am I headed? What's the rest? An hour before bed, you're kind of aware of the fact that you're going to go to bed soon. So at that moment, you're not going to run a marathon or start cleaning the house because you're like, well, in an hour, I'm going to be in bed. You might even start like, well, this is my chill time. I'm going to chill. This is the hour I just, watch Netflix or something. Well, that's what I'm like about death is like, okay, I'm 48 years old. Where am I in my day of my life? You know what I mean? When I was 20 and when I was 19, I had the same thought. I'm like, I'm 19. I'm going to be dead probably around the age of 80 or something, 90 if I'm lucky. And what does that mean? I'm 19. And I could die tomorrow. That's another thing. It's like, I might actually be dead soon. So how does that inform my life now? What am I supposed to be doing right now? You know what I mean?
Yeah, this is the morning of my life.
Right.
At 19.
Right. Now at 48, I'm at like, 6 o'clock or something, or
it's after lunch.
Yeah, it's definitely after lunch. It's dinner time. And what does that mean? Like, what does that mean to my life now? What perspective? What should I be doing? And that's when I say death anxiety, that's kind of what I'm talking about. It's more of like death awareness. And sometimes it's upsetting, to think about. Because like,
me too.
Even if you believe in an afterlife, there's no real way to know.
And if you don't,
then you don't. And it's it. And so it's, I don't know, it's upsetting to think about me and everyone that I care about just no longer being able to enjoy life anymore,
Yeah. I think the worst part about death to me, at least as I consider it these days, is there's 51 years of gathering experience. And I sort of feel like, oh, I'm 51. I'm sort of coming into my own a little bit. And at some point, it's all gone.
Yeah. How do you feel about that?
That sucks, man. It brings me down.
Brings you down.
I get scared about it and I feel sad about it. And, life is like walking the plank. You might not know how long the plank is, but...
How often do you get scared and bummed out about it?
A couple, 3 times a week.
Right? Okay. So I don't get bummed out about it as much anymore. Does it happen particular times of the day for you?
Nighttime.
Yeah.
When I'm going to sleep, it often happens.
Yeah.
Yeah.
So do you have a conceptualization of why that happens? Because that's the same for me. It's when my head hits the pillow, it's dark, and that's when like those thoughts become extremely vivid to me.
Yeah.
Like right now, I intellectually understand that we're all going to be dead.
Sure.
You and I are going to be dead.
Intellectually, yes.
Like you and I are going to die at some point.
Yeah.
And if there is no afterlife, then we just no longer exist. We're obliterated.
Yeah.
Every memory, every thought is just gone. And in 1,000 years, every trace of us will be gone.
Maybe your podcast will live on. Maybe.
Maybe not. And so it's just dust in the wind, right?
Yeah.
And but yeah, do you have a conceptualization? So right now I understand that, but tonight when my head hits the pillow and it runs through my mind, it feels so much more present and upsetting.
Like a felt sense of your mortality as opposed to an intellectual awareness of it.
Yeah. Why do you think it is?
I think nighttime when I go to sleep is just reflective for me.
Yeah.
You know, like I live in a nice place, it's a nice house, and I sleep with next to this really nice lady. And somehow when I think about those things and my appreciation of them, I feel the temporal nature
or the
of being human.
temporary nature.
Temporary, yeah, it's a temp job, man.
Yeah. I just realized that temporary is a temporal word.
Yeah.
You ever do that? You're really just like,
Oh yeah, I love
make a
words.
connection. Like,
Yeah.
did you know that connection?
I don't know. I don't know if I ever thought about that one.
Yeah.
There was another one I had last week, but I can't remember what it was.
Well, one that really blew me away like a year ago, or maybe it's like 5 years ago actually, was understand.
Oh, I was just thinking about that word the other day.
Oh, right. It's like, I always just sort of said understand
Yeah.
without thinking about the fact that it's two words,
Yeah.
under and stand,
Right.
which is a metaphor for standing under something, which, is a metaphor for comprehending something. You know?
Yeah. Do you know what the etymology of that word is?
I don't.
It's fucking fascinating.
Do you?
No, but
Oh.
I could look it up.
Right. So my conceptualization of why they become much more vivid when my head hits the pillow is
Yeah.
that when people fall asleep, from what I understand about brain science, is that we have a lot of different functions in our brain. There's functions that keep your heart going. There's functions that are for vision. There's functions for math, for language. And some of the less important parts of your brain start shutting down before the other ones do, And one of the ones that shuts down is this ability to kind of soothe the self, or to to see something in a way that gets you through the day. Because if the notion of death was not tamped down by our brain, all of us would just be in despair, right? So I think there's some function of the prefrontal cortex, honestly, that kind of keeps it in perspective, or keeps you almost kind of unaware of the reality of it all. It's just like, well, let's not focus on that. Let's get you through the day.
A defense mechanism, essentially, coping or whatever.
Right. And when my head hits the pillow, that part starts to fade.
Yeah, it goes to sleep.
And this deeper part of, amygdala or something, I don't know what I want to say, but is still running, active, still has a lot of strength, and has nothing pushing back on it. And suddenly it, this reality, is sharp. It comes into sharp focus. And I think that it's not just death anxiety. I think it actually applies to that's why a lot of people can't fall asleep, is because their head hits the pillow and suddenly they're going over every shameful, seemingly stupid thing they've done recently or in their life. And there's no brain mechanism to sort of push back on it, because sometimes all I need to do is just get up and, go to my computer and kind of browse the internet and give me 5 minutes, and my brain kind of wakes back up, and then that function kicks back in, and I'm no longer in despair about death. It's just, and then if I quickly go to sleep, having said that, I can't remember the last time that happened to me, but, would have been, I don't know, 5 or 10 years ago or something. But that's my conceptualization.
Yeah. Interesting.
Anyway, so getting back to your question about, whether or not you should tell your clients they have narcissistic personality disorder. So I do not tell clients if they have a personality disorder in general. For some of them, I will, like Bob, you have a lot of clients who suffer from borderline personality. And do you talk with them about that?
Occasionally, though, sometimes people find me because they've already been diagnosed as having that, or believe they have that. And so, what I've noticed about people in our profession is we have a kind of bigoted prejudice against that particular label. And we are the ones that freak out about it. Several clients that I've talked that over with find it validating and relieving to know that this is a thing.
Right.
That this has a cause, it's this thing that happens, and they don't associate the word with anathema the way mental health people do, and the way mental health people communicate that to the people that we are here to serve.
Right, which is upsetting.
Just sucks.
Right. They will say, clinicians, many, I would say a majority in my experience, will say, oh, she has borderline, watch out for her.
Yeah, exactly.
You know? Or she has borderline, you need to terminate. Or you need to get rid of her. You know, like you need to get that out of your office. We need to get that out of our agency.
Yeah.
Because there's a stigma and a false notion that they're going to sue you,
right.
and you know there's all these bad things that are going to happen.
Right.
Yeah, it's upsetting. But narcissistic personality disorder, you go on the internet, there's, you know, because I've done a deep dive on this, and part of my deep dive was to look at, you know, a lot of things that are being said on the internet, and I could only find, out of probably thousands of sources and even clinicians talking, there was only one source that I found to be accurate.
Wow.
It was this one random YouTube video that was just someone talking over this graphic, and I found it to be the only thing on the internet that even came close to talking about narcissistic personality disorder. You look on the internet right now, and because it's sort of trendy right now to talk about narcissistic personality, and the associations that people will have is that they are abusive, they gaslight you, they're manipulative, they are psychopathic, sadistic, maybe even is associated with narcissistic personality, which is just not true.
Yeah.
And I mean, sadism is associated with sadism. But there are plenty of people who have narcissistic personality disorder who are not quote unquote manipulative. If you get close to them and they have a particular bad case of it and they get particularly triggered, they can get quite upset and they can become abusive for sure. Absolutely. Yeah. I mean, there's a lot of abusive people I have found to have narcissistic personality disorder, but it's a lot more understandable when you understand them. Anyway, so the point is that if for people that I've treated with narcissistic personality, I usually don't say they have narcissistic personality, even though in my mind it is what they have. But the reason why I don't tell them is I would have to talk at them for 10 hours to help them understand what I mean by the label. Yeah. Because if they just walk away, and of course they're going to Google it, they're going to get the wrong idea about what it is. And so I don't do that. What I do use are phrases, and you'll hear me say this on the podcast, I will use phrases like relationally traumatized, for example, or pathologically independent, or defensively controlling, or defensively grandiose.
They're phenomenological labels.
Right. These are way more specific and precise terms, and immediately understandable than narcissistic personality disorder, because it's such a bastardized term in our society right now that I wouldn't want someone to get messed up with that. Right. Whereas when I look at them and I say, you are defensively controlling, and we have a rapport and we've investigated that enough, they're like, I get defensively controlling sometimes, The other thing is that the whole concept of personality disorders are, fraught in a lot of ways, because they, especially in the DSM, because the DSM is trying to scientifically describe a personality condition or a personality type. And the DSM is not good at that. So, and the DSM, for some reason, we've allowed it to dominate our understanding of things. And I always like to point out to my supervisees and students that the DSM is written by human beings. It didn't come on high from God. So when was the last time you read something that was written by human beings that was flawless? Like, there's no book on any shelf that is flawless and all-encompassing.
Some Stephen King novels, you could make the case.
And so the DSM has problems, and it has a task. It has a difficult task of trying to scientifically describe things that are completely amorphous, opinion-based, self-reported, squishy things.
Culturally biased.
Cultural things.
Yeah.
Right. You ask someone from the South from rural Louisiana,
Right.
what depression means, they're going to have culturally a different sort of notion than a Seattle person has on what depression means.
Right.
So anyway,
In Seattle, it's just Tuesday.
But the label of narcissism is meaningful to me because we have like 120 years of psychoanalytic, psychodynamic personality research and discussions that use that term. Kohut, Kernberg, Freud, Jung. There's just a lot of research around that, and so I like to use that term in my head and outwardly for that reason. But honestly, I kind of wish we would have picked a different word from the beginning.
Sure.
Like histrionic, for example, is just a really terrible word.
Is that still in there?
Is it? I think it is.
Is it? Yeah.
It was. I think they were trying to get rid of it, but.
Oh wow.
But yeah, I mean, histrionic goes back to when the Greeks thought that women's uterus, their uterus would travel around their body and cause all sorts of physical ailments and behavioral and psychological ailments. And when Freud and Breuer were first diagnosing people and people of that time, they were still using this term of hysteria and histrionic, and so it's a legacy from that. So I wish they would. I wonder what other name you could call it, like attention-seeking personality disorder or something is so much more descriptive. With narcissism, it maybe a term like I like the term defensively grandiose, because it describes it. It's like you're grandiose, but it's a defense.
Right.
It's not like the way people describe it. It's like narcissistic people wake up in the morning, they're like, ha ha ha, I'm gonna be better than everyone else. It's like, no, they're suffering deeply on the inside, and they only do that because it's the coping style they were rewarded for as a young child. That in the same way we were talking about dissociation.
Do we know anything about how Freud in Freud's day would have seen that word? Because once it lands in the language and it sticks, it gets used, overused, and then used as a club, like to bash people with.
Yeah.
You've got borderline, which is just an awful sentence.
Or the word retarded.
Yeah, like the word retarded.
Yeah.
And pretty much anything you can think of. So do we know anything about what people in Freud's day or in the early days of psychology, what their own valence to that term was?
I've researched it. I don't know it off the top of my head.
Yeah.
And
it's probably not as loaded.
No. And it's also harder to figure out because Freud wrote a lot in non-English.
Right, German, yeah.
And two, it's him and all his cohort spoke a particular language of shop. There's a certain shop language that when you read Melanie Klein or Jung or Adler or something, and Freud, it's sort of like reading another language, even if it's in English.
Even in English,
it's just like, well, what are they referring to?
Right.
There's all these references that it's like picking up a aeronautical engineering book and flipping to chapter 5
Sure.
and just trying to understand what they're talking. You
Right.
wouldn't understand it because they assume that you have prior knowledge before reading that paragraph.
Right.
And so I don't know. That's what I'll say about that. But early on, narcissism was understood as a defense.
Yeah.
Early, it was understood as a defensive thing.
So not a term likely to be used as an epithet.
No.
Yeah.
Yeah.
But
do you use the word retarded anymore?
No.
Because sometimes it occasionally kind of comes out of my mouth. Not in I've never used it as a derogatory term, I hope. Right. Because when we were young, retarded was not a bad word.
Yeah.
There was there were probably words before retarded that were used in a hurtful way that became bad, like imbecile or
idiot,
yep. Moron. Like imagine that. Imagine it's just so hard for you and of our generation to imagine that a clinician in a compassionate sense would call someone a moron.
Yeah.
Like this person's a moron.
Well, you know what they used to call Down syndrome?
What?
Mongoloid idiot.
You're right. So,
Yeah.
because other people would come along and use it as a insult.
As an insult.
They go like, "Oh, you're a mongoloid idiot.
Right.
You're an idiot. You're a moron."
Right.
In the same way, during our lifetime, people started using retarded. "Oh, you're retarded. That's retarded."
Right.
And now, the slang use of the term has completely eclipsed the rather dry, because all retarded means is that you learn slower than other people. That's all it means.
That's all it means.
Like, it's not a big deal.
Or it doesn't even have to do about learning. It just become about learning, because you could say that an object is retarded if it's like say molasses. It's you freeze it or you cool it and it rolls even slower, right?
Right.
It just means slow.
Or in music, a retardando.
Right, retardando. Yeah, slowing down the tempo.
Yeah, and all these words, like I think I said something to someone recently where I was using it for a physical or maybe a music sense. I was like, "Oh, because you can say there's a retard there in music." And someone was like, "What did you just say?"
Yeah, right.
Like, you can't say that word anymore. And I was like, because we're older, there are certain movements that we won't notice. It's sort of like, like older black people will use the word colored. Because colored, when they were young, was not a bad word.
Right.
I mean, the NAACP, right? The National Association of American Colored People, is that what it is?
Advancement of colored people, yeah.
Advancement of colored people, right. I mean, one of the major organizations for African Americans has the word colored in it, but of course you could never say colored because it was used as a horrible word, This is all things that everyone knows. The point is that's why I would never or rarely introduce the word narcissism to a client, because of this reason.
It's 'cause all that baggage.
To me, it means nothing bad.
Yeah.
Borderline, what to me, the valence I have about borderline narcissism, histrionic, is nothing bad. There's nothing. It's just that everyone has a defense to the problems they went through when they were children.
Yeah.
And we have lots of different words for those things, and 3 of them happen to be histrionic, narcissism, and borderline.
Yeah.
And but to clients, I would really hate it if they thought of it as a bad thing. So a very long answer to your question, patron, is what Bob answered it right away, which was, what's the goal?
Yeah.
What are you trying to achieve? Does it further the goal of self-awareness, of helping someone to conceptualize why they are the way that they are? And if the stigma doesn't outweigh, if the costs don't outweigh that, then you can do that. But I consider it more of a nuanced thing with people. Let's just end there.
Sure.
We only got to 2 people, and I have a long list, so we're just going to have you back on the show another time to answer these other questions.
Sounds good.
What do you say?
Yeah.
Well, that does it for that episode of Psychology in Seattle. Thanks for joining us out there. Please take care of yourself, because
you deserve it.